Hello everyone. So this is the heart of the scavenging system that is designed to get attached to the breathing circuit for COVID-19. And inside you can see that there is a one-way wall which is attached to a CPR pediatric mask connected to an aluminum cylinder. So this is the one-way wall, and this is a breathing one-way wall which has a fish mouth like opening. So the task for today is to prevent the leakages from this one-way breathing wall. So I'll put the one-way NIV wall in the glove and put a knot on the open side of the gloves. This will ensure that the wall does not leak. The function of this wall is to prevent the backflow of patient's expiration air into the breathing circuit that I have designed. The output of this expiration wall goes via a pediatric CPR mask into an aluminum cylinder that you had seen before. The aluminum cylinder harbors a 11 watt UVC light which neutralizes all the virus particles as the air travels from one end of the aluminum cylinder to the other end of the cylinder. To ensure that the air is traveling through the aluminum cylinder in an airtight manner, it is essential to attach the expiration port of this wall to a pediatric CPR mask which nicely fits over the input side of the aluminum cylinder. Good thing about this design is that the air is forced to travel along the length of the aluminum cylinder. This ensures that the expiration air comes in contact with a UVC light for a longer period of time, which is essential for a log 6 reduction in the number of virus particles. Aluminum is a good reflector of UVC light, and it reflects about 70% of the UVC light. Plus, there is a nice circular design to the aluminum cylinder, and the tube diameter is also circular, so it ensures that the radiation level is uniformly maintained along the entire length of the cylinder. This is a referencing paper which I have used to know how much length of the cylinder is required and what time or duration is required for neutralization. Equation 6, UVC light 11 watts at 2 cm takes 1.7 seconds. This is for log 5 reduction without the use of aluminum reflective cylinder. With aluminum cylinder, UVC watts will increase due to reflectance, and it will take less than a second, which is sufficient time for log 5 reduction. I am trying to fit the expiration wall into the circuit expiration port. So these junctions are airtight. So right now the joint that you are seeing, the air is going to enter through this part and it is going to be forced to pass through this aluminum cylinder, and this silicon piece of material that you are seeing where I am attaching the expiration wall is nothing but a pediatric CPR mask which fits very nicely on the aluminum cylinder. This is the power supply for the UVC light. These are the holes that I've created on the plastic which connects the aluminum chamber to the UVC light. This white sticking prevents the UVC light from getting pushed in, because if it gets pushed in, it will block the CPR mask on the other side. The other end of the UVC light also needs power supply. It is hidden behind the CPR mask. So instead of creating a hole on the CPR mask to give the other end of the UVC light a power supply, what I have done is I have run the other end UVC light supply through this hole that I have created. It also allows for expiration of air. This UVC light will also create bit of ozone, but it will get washed off with the patient's expiration air. Unfortunately, the UVC light needs a 230 volt power supply, so it will need a very huge battery which will prevent it from being mobile. So what I have done is I have put it in a cardboard box and covered it with a HEPA filter, which is also backed up by an activated charcoal carbon filter. This way the ozone that is released from the UVC light is getting absorbed in the activated charcoal filter, which is not released in the OT. And when the UVC light is not on, when the patient is mobile, at that time as well the expiration air from the patient's breathing is passed through a 99.97% active HEPA filter. The expiration port of the patient's breathing circuit will directly get attached to this scavenging unit expiration port, and this is a carryable circuit. As you can see, you can put it in a bag and the patient's expiration port will get attached to the open pipe at this end. The breathing circuit is prepared even before the patient arrives in the preoperative area. It consists of the CPR mask, the T-shaped adapter, one-way breathing valve which serves as an inspiration port, and a long expiration tube which gets attached to the scavenging bag. Now you can see the healthcare worker is fixing the expiration port of the scavenging bag to the expiration tube of the circuit. This is essential before connecting the circuit to the patient. Care is taken so that there is no air leak along the joints of the circuit. Each patient will need a different circuit that has been already prepared for the day of surgery. One will need a minimum of 2 scavenging units because the second scavenging unit will be attached to the patient in the preoperative area while the first scavenging unit is already in the OT. So before removing the patient's mask, it is essential to place the CPR mask on the patient's mask so that the healthcare worker is not exposed to the patient's expiration air. And as you can see, first remove the patient's mask and then directly keep the CPR mask on the patient. The portion of the circuit is quite bulky, so the cloth mask makes it more stable and it protects the healthcare worker from accidental slippage of the mask while trying to fit it to the face. It doesn't matter how the cloth mask is attached, we can always readjust it later. This rotation of the T-joint and this particular angle of the T-joint and the inspiration wall is essential because if you keep it horizontally, then you would not get enough hand clearance to operate for the right eye of this patient. This meditative sticking is the key. This has to go from the ear of one side to the ear of other side, and you need 2 or 3 layers of the sticking on top of one another to ensure that there is no air leak. I have experimented with various types of sticking material, various angles and degrees of the sticking, various lengths of the sticking and various positions of the sticking, and found that using a cloth mask and using a sticking after that, it is a best solution to protect the healthcare worker while putting the circuit and also ensuring that the CPR mask is airtight in nature. With this type of stickings, I have also conducted underwater testing of the patient after his face is submerged in a water bath, and that independent YouTube video is already uploaded to my channel. It was necessary to do these extensive tests because everybody was saying that the CPR masks are very leaky. So to know what type of sticking and what type of attachment will ensure that there is no air leak around the CPR mask was essential. It looks like a time consuming process, but this time is spent in the pre-operative area. This is not the time that is required in the operation room. In the operation room, the patient will come, lie down, and he will go back. So the time for putting and removing it can be monitored by use of such video techniques. Attaching the circuit to the patient in the preoperative area ensures that there is no aerosol release from the patient in the operation theater. Once the patient lies down, you can connect the power plug of the UVC light to an electric socket, and this will activate the UVC light that is present inside the scavenging unit. The surgical exposure I get is sufficient for me to do a temporal phaco. I have not tested it for superior phaco or superior surgeries yet. The draping might be initially difficult, but after few cases one gets the hang around it. O2 sats are nicely maintained with the help of the circuit. In very shallow breathing and very anxious patients, there are chances of rebreathing. The surgery is uneventful, and after the surgery, I follow my routine steps of removal of speculum, removal of the drapes, If you use larger drapes, then you will have to be careful to unfold the larger drapes, and it is better to use one more drape on the circuit so that you might be able to use a larger drape on top of the smaller drape.
या काही त्रास झाला का? हां ते श्वास घ्यायला काही त्रास झाला का? घेता आलं?
Patient's voice does not transmit very clearly through the mask.
खोलिया.
This is another uneventful surgery with the help of this breathing circuit.
ठीक आहे.
Removal of the circuit, we do it in an open area. A 3-ply mask is used as soon as the circuit is removed. This 3-ply mask has bleached tissue paper inside it, so it will pass the flame test. This mask exchange will need the help of 2 healthcare workers. After removal, do not dismantle the circuit. Use a numbu bag and attach it to the CPR mask and push air through the umbu bag so that all the air in the expiration tube of the circuit is pushed to the scavenging unit. After this process is done, all you have to do is to dismantle the circuit and then put it in sodium hypochlorite solution and dry it for the next day to be used. Here's the list of materials that you would need to construct this circuit and their available sources. Also check out the previous videos which explain why it is essential to use these large diameter tubes for the patients to breathe and why the CPR mask is best suited for this kind of circuit. Thank you for your attention in watching this video.